Welcome to the Generous Benefits Podcast, where we help employers create meaningful people-first benefits that make a real impact. I'm your host, Amanda Brummett. Today, we're digging into company culture, how to assess it, how to fix what's broken, and how to sustain it, with two guests who live in this world. Sarah Matt, MD, a physician leader, surgeon, and writer on burnout, systems, and the role of AI. And Amy Gurske, CEO of Say Hi, a platform for real-time, human-centered employee feedback and connection. Amy and Sarah, thank you so much for being here today. Before we get into all the fabulous work that you ladies are doing, I'd love to start with just who each of you are, personally and professionally.
So, Dr. Sarah Matt, surgeon turned healthcare technology strategist, been in a lot of places, medium-sized, hyperscale, startups, all the EMRs people love to hate, lots of interesting technology. And ultimately, now I do a ton of different work. I'm bringing a book out to the world with Wiley in December called The Borderless Healthcare Revolution. And it's all about how technology can decrease barriers to care. And, it really brings together my clinical side and my technology side. So that's what I'm working on right now.
And I'm Amy Gurske. I am ex-corporate America turned startup junkie. So I am the founder and CEO of Say Hi. Our goal is to listen every single day, say hi every day, to optimize the health, well-being, and productivity of every employee. And the reason I built it is because I fell through the same cracks that I'm trying to help others fall through. And outside of work, I live in upstate New York. So I love being outside, being with foster animals, doing volunteer work, and genuinely just giving back.
You know what, Amy? We need to make a double tap here for upstate New York, because I also live in upstate New York. And so I've got the Syracuse side. Amy's got the Rochester side. Upstate New York is coming back. And
you know what's so cool is we're boomerangs as well. So both you and I have had the privilege of living and working all over this country and world. So I love that we both boomerang back to upstate.
Love it. So there you go, Amanda.
Well, so when I was trying to decide what to talk to you lovely ladies about, there were about 1 million topics that came up, but culture is really the one that really seemed to stick out for me. So I would love it if either one of you can tell me what culture is and why it matters.
Yeah, I mean, for me, I love studying culture. And really, when I look at a very high level of what culture is, the question you can ask yourself is, what is acceptable? What's acceptable and what isn't, right? Mm-hmm. Culture is essentially a shared set of values, beliefs, behaviors, norms, and or symbols, really, that a group and people think, feel, and act around. So for me, it's what's acceptable here. Does that make sense to me? Am I in line with that? How do people communicate and collaborate? And what's rewarded, ignored, or discouraged? So those are like the three ways I look at it, right? What is acceptable? How do people communicate? And what's rewarded, ignored, or discouraged?
So on my side, when I think about the culture aspect too, I think probably half the books behind me here are all about leadership and business and culture. And we all have all those books on our shelves these days. But ultimately, as a leader, as an entrepreneur, as someone who's led huge teams all over the world, it's essentially what makes or breaks a business. Half the time, people have amazing ideas, amazing technology, amazing everything, except the people are what can either make or break the entire organization and be the difference between you being a profitable and successful founder or a profitable and successful organization at large. So I think, to me, they always say, oh, culture eats strategy for breakfast. I wouldn't go that far, but I would say it's very important. And if you're not paying attention to it, you're going to be awfully sad in the future.
Definitely. And as I hear you saying that, I think about how important that is in an operating room, and that it can literally make or break the case. I'm so excited to have both of you and both of your brains on this topic today. So there's 1 million ways that we track culture, but if you could just track one thing to know if culture was healthy and if it was working, what would that be? And then are there any other early indicators to spot trouble or tell you if something's amiss?
I will jump in and say, so one of the elements that we measure at Say Hi is culture, a satisfaction of the current culture. We always start our line of questions with a trust question, because if there is not trust in an organization, then I don't care what the culture is, you're not going to be successful, because people need to trust in the people that are building that culture. So for me, the first indicator is trust, followed by communication. So if trust starts to slip, We got issues, right? You don't leave a manager, or you don't leave the company, you leave the manager, right? Or you don't leave a job, you leave a boss, whatever, quit the job. It really has to do with trust between you, your manager, your peers in the organization. And then that's built on communication. Am I getting what I need when I need it? Do I feel heard?
When we think about how most leaders today in health delivery systems and high tech, you name it, how they decide what their KPIs are around that, often it's very default to, did I hire in a timely fashion? Did I retain? Why are people leaving? And usually there's not a good reason. It's just numbers issue. And so if we look at that as an engagement score, an idea of how successful we are, I think we're really losing a ton of context and a ton of space to really help your business. Amy and I spoke about this before our call, and ultimately it costs a lot of money to hire in new people, but it costs a ton more to replace someone that you were unable to retain. And so those KPIs that I just mentioned, those don't tell you anything about how you can retain and save money and actually impact your bottom line. So I really love what Amy's talking about there on the trust piece. Being able to measure that in some reasonable quantitative fashion is going to be key to success.
Yeah. And how do you measure trust and communication in a quantitative fashion?
Well, when we set out to launch Say Hi, first off, we built a program that was completely based on human behavior. So in my intro, I didn't talk about the fact that I actually studied engineering. Yeah, one of those weirdos.
Oh, wow.
Yeah. I was an engineer, went to a male-dominated private little school in the middle of nowhere. And but then I started practicing and getting out in industry, doing supply chain consulting. But I realized that people follow process and people utilize technology. So if I didn't learn about humans, and I went back and got additional degrees in organizational psychology, behavioral analysis, all that good stuff, we ended up building a system that was completely based on human behavior, because humans are struggling right now. All of our humans are struggling. We're all struggling to a certain extent. There's a lot of information coming at us. So to be able to effectively manage and measure something like trust, we had to build a program that, first off, people could trust, because it has to be safe, but B, it has to be so simple that it's almost easier to answer in exchange with than it is to skip. And so when we launched Say Hi, we launched it. And essentially, like I said, the concept is we say hi once a day, less than 3 seconds. But we're going to run you through a host of different questions. You don't even know what question you're answering and what it's necessarily measuring. And so, like I said, we'll always start with trust, but then everyone's going to be on their own journeys internally getting their questions. So it's really a program that's built between trust between the individual and Say Hi. And then the benefit becomes that real-time data to the organization so that they can spot those trends. But any technology needs to be built around human behavior. You cannot build it and they will come to it. That's not going to happen. We really need to think about smart user design that is actually bringing benefit to our humans while keeping them safe, productive, and healthy at work.
Yeah. Amy's perspective is invaluable here, because ultimately most leaders decide not to measure trust, because if you just heard what Amy was saying, oh, well, we're asking all these different questions, they may not know what they're actually being measured on. It's because there is sentiment. There is different pieces here. There is, different AI that they're using within Amy's organization to make sure that they're asking the right pieces to get the right metrics. But I think that most leaders, they can't see that hard API on how to measure trust. And so they just skip it altogether. Oh, well, it's a squishy KPI. We can't deal with that. We're going to skip it completely. And so I love that we have a system that your organization, Amy, is producing that ultimately is taking that and putting guardrails around it and asking the squishy questions to the people who need squishy, and then making them into hard dashboards, analytics, et cetera, for the leaders that need those fast and true numbers.
And then you talked about making it something that's easy and natural, already part of the user's day. So are you're doing that via text? Are you embedding it in an EHR? How and where does it show up? And is it the same in every organization, or is it different?
Yeah. So when a user first logs in, types in their little password or scans in, like you have a badge, right? You might be badging into a computer if you're in, an practice setting. Essentially, when you log in for the first time in the day, you're just going to get one pop-up. So it's automatically going to pop up. There's no X out. You can answer it or skip it, like at 1 to 5. The cool thing about Say Hi, though, is, again, we don't even know what question we're going to ask you until you answer the question the day before. So Say Hi uses its line of question to diagnose each individual's need. So Sarah could be lacking communication, but we give you also the metadata, right? So Sarah needs more frequent communication, or maybe it's clarity of communication. Amanda, however, has low trust with her manager, right? And trust is a really hard one. So we're going to use our networking algorithm to get you connected to other people to find that sense of belonging. There could be an individual like myself. So I share very openly, I am in recovery. There could be someone that says, I am dealing with the stress of work by drinking too much at night. Well, we can also funnel in resources without stigma, specifically in healthcare. Never tell anyone that you're struggling with addiction, right? Yet there's a lot of people that are. So we need to make sure that resources are getting to people without stigma. Things like peer support, whether it's EAP benefits, whatever it is, even learning gaps, getting people the skills and resources that they need. But we don't know what people need until we ask.
That's incredible. Wow. So that sounds like a really effective tool that every company needs to be using some version of. Are there other cadences or traditions that you've seen employers use to move the needle and get positive outcomes?
There's a lot of options out there. I will say we are innovating, right? The space is innovating. There's no right or wrongs when I give you some pluses and minuses, right? So what we're all familiar with is the annual survey. We've all taken one. We've all done it. We've gotten the email link. We sat at our computers for 45 minutes and clicked the little squares, asking essentially the same questions and really nothing that directly impacts us.
And feared retaliation from it.
Oh, yeah, 100%. They're like, oh, well, you guys said that you like your salary, so we're going to go ahead and cut those. No, I'm just kidding. But very little action, so people stop doing them. So it's a lack of adoption. If you have a program that's not getting adopted, then why do you have it anyway? What the research shows is that pulse surveys, so quarterly surveys, monthly surveys, actually draw more disengagement than they do engagement. Now, you would think you're asking me to do it less, I would do it more. It's still that interaction of clicking an email, taking a ton of my time, and I'm not getting anything back from it. So really what we're trying to do is communicate with our employees in a new way. We're training a behavior of answering a 3-second question a day, 12 and a half minutes a year to get live data on everybody. We're training a behavior to essentially give us your input in the beginning of every single day in a very safe way. Once you get that, so I like to say, and I'm very proud to say that we have a greater than 90% daily adoption. People like giving their answers to Say Hi, because one thing we didn't talk about is, we're going to give real-time data, anonymized and aggregated to the organization so no data can ever be weaponized, but every single individual gets activated. That's those private connections we give you, those workplace vitals, burnout, capacity, all those things. So not only are you answering a question, but we're taking you direct to action. So an annual survey doesn't give you an action. And in fact, it doesn't typically impact anything you're doing. And same with pulse surveys. If you don't see the result of the activity, why would you do it?
No, and you might actually make me mad because you took my time to ask what I wanted. And then if you didn't get back with me, now you wasted my time and I'm less happy than I was before.
Yep, exactly, which create disengaged employees. So although organizations are trying their best, they are actually creating their own disengaged employees by asking them to do things that they don't want to do. So that's why newer solutions need to come out. We need a better way to listen to people on their own terms, though. But there's so much that I cannot take the weight away from human interaction. Town halls quarterly with leadership, absolutely. One-on-ones with your manager, and also creating some form of team building. Even if it's on a Zoom call, pull out an icebreaker, get someone laughing. You should always have a non-transactional part of your team meeting every month. So at least once a month, pull out something non-transactional and get everyone to go around the room and answer. It's kind of like a show and tell, right? Believe it or not, it creates that sense of belonging.
And then Sarah, what about you from a system perspective? What fixes have you seen that actually reduce cognitive load and burnout and actually improve team experience?
I think it's difficult to say in general because every organization is different. And if we think about the healthcare landscape, a delivery system is very different than a tech organization that's producing solutions for a healthcare system. And so when we think about it, I think right now we have one of the most burned out populations within delivery that we've ever seen. So between nurses, doctors, and again, I think a lot of people forget that there's also people in environmental services and lab and this and that. There's so many human beings in this ecosystem. And if we look at that environment, I think right now it's almost up to individual managers to keep their own team engaged. And they're doing a great job when they can. But if you are strapped because as a manager, you're a player coach and you're doing a lot of individual work too, that becomes more and more individual work and less managerial efforts to keep your team engaged, understand the pulse of your team, et cetera. And so what I see here, especially for this piece, and then especially when we think about the shift work culture too, where you may have a manager that doesn't necessarily work on your shift, so you may not see them in person, is that the in-person pulse checks, if you will, on a daily, weekly, et cetera basis are becoming less viable. Unfortunately, now it's an email or, hey, haven't seen you in a while. How's it going? Or, oh my goodness, it's so nice to see you. And you're running past each other in the hallway. And so I think the engagement piece is fizzling. And I think the other piece is that the tools right now have been weaponized almost in a way because the EHR, no one loves their EHR. Whatever system they're using, no one loves it because it's become very administrative, a lot of data entry. And so when we consider how these, we'll call them pulse checks again, have occurred through large enterprise HR systems, I think what you had mentioned before is true. People are concerned about giving their real opinions. People are concerned about even giving their own managers a sense that maybe they need assistance, aren't doing well at something. In an economy like this in the United States, it's even worse. So I think right now we're in a spot where there's not a lot of amazing things that are happening well, except in individual teams where managers have the ability to manage personally.
Mm-hmm. Yeah, most definitely. And I appreciate, Amy, your direction towards making sure it flows into their regular day. And Sarah, we haven't talked about this, but you talk about that a ton in your book that, in order to make technology work, you've got to start with that user. So love all of that. I do want to add one thing that's low tech, high touch. And Sarah, you made me think of this when you're talking about the shift workers. And I've spent my entire career in healthcare, but I think this applies to other industries like manufacturing, is that leaders need to get their tail out of their office and out onto the floor. And that includes nights, that includes weekends, that includes holidays. Take off the suit, throw on scrubs or whatever you don in your work environment and go talk to your people, go sit with your people, go observe, go listen, go help. And then take all that fabulous technology and let that augment that personal touch. So then we kind of get the best of both worlds. I don't know. Am I oversimplifying humanity?
I don't think you are. I don't think you're oversimplifying at all. I think what you're saying is, wow, humans like other humans. And when we actually manage humans as people, we do better. And I think that's the case. I know that's kind of how I manage too. Amy, I'm sure you're the same. I love to know who's working with me. I love to have colleagues. Before we even started recording today, you heard me and Amy bantering because we're fast friends and colleagues. But when you think about it, these relationships are the currency of business today. And we are some high-powered ladies on this call, but every level of an organization has those connections because when you're having a day that's maybe not the best, your colleagues hopefully helping you out and back and forth. And so we rely on these human relationships to do our jobs, but we also rely on these relationships to get promoted, to get a new job, to make it through the next day, to make it through our next promotion cycle. And so they become more and more important. And if you haven't seen your boss, and I say seen, I mean be seen by your boss, then you're probably not going to do very well in that organization because they're supposed to advocate for you and help you through your journey.
And we have a saying, so being a tech founder, a deep tech founder who does use elements of AI, obviously that can be fearful for some people when they hear AI. And I have a favorite saying, which is we use AI to listen, diagnose, and connect, but always humans to humans, always humans to training. So it's not just a tech like Say Hi is not going to fix your culture. I love that Sarah talks so much in the book and also just in real life about you've got technology, but then you've got this culture, you've got these people. And if there is a disconnect in there, you can't just force technology and think that it's going to solve the problem. It's meant to make it easier, but we always need that human element. I can't foresee a world in healthcare where there is no human element. And if we've gone that far, get me out.
Absolutely. Well, I want to go off the path from culture for just a moment. So employee benefits is what Generous Benefits does. And we are playing around with a tool that offers ambient listening for patients, not for doctors, for patients. And the intent is definitely altruistic. It is so that the information comes back to the nurse navigator, and then the nurse navigator can answer questions for mom, dad, grandma, whoever, and help them find the right and next care. But it's complicated. It's complicated for providers. It's complicated whether or not we want our insurance company to know all that. So, Sarah, while I have your brilliant mind here who writes on all things healthcare and all things technology, I was super curious, both as a physician, but as a leader, what are your thoughts on that? And any advice for employers, things they can do to help make it a little easier for their employees to navigate without taking off their doctors and telling their insurance company too much?
So, Amanda, I love this topic. I actually wrote on this last week
Yes.
because there's so many different organizations I've seen in the landscape working on this. So there's absolutely a market, which is amazing. So I love what you're doing. I think there's kind of a couple aspects to this. First, as a provider, do I want to be recorded? So I would be concerned about, hey, did I say something wrong? Did all of a sudden I add a swear word to this podcast and now it's explicit? Whatever it is, are my individual words going to be taken against me? Because again, in today's world, we have a lot of litigious things occurring as providers. It's difficult. So as a provider, I don't know. I might be on the fence about being recorded. And if my employer forces me to be recorded, I don't think I would react well to that. I think I would definitely not react well to that. As a patient, though, oh my goodness. Yes, yes, yes. As a caregiver, oh my goodness. Yes, yes, yes. I think the worst potential thing that could happen is that you essentially get cared for. You're there in the operating room, waiting room, physical therapy room, whatever it is, and you get some information, and it's not a normal environment. This is not I'm going to be listening really well and absorbing everything environment, because hard news is hard to listen to. And so by the time you get to the parking lot, you're not going to know what to tell your spouse, your parent, your kid, whatever it is. And so I think having that as a patient would be great. I don't get to all my parents' doctor's appointments. It'd be great if I had that information so that we could have a really great discussion after the fact. I think the winners in this one, however, are going to be the data brokers. So who is this data going to? And as you mentioned, okay, well, will the insurance companies get this data? Will these folks get this data? And whoever's brokering that data is going to do just fine. However, I think, again, are we giving enough value to the patients? In this case, maybe we are, but maybe we aren't from an insurance perspective. Hard to tell. And so if they're getting value that they see, maybe they're willing to give that data. On the provider side, what is the benefit of this solution to the provider? I see that maybe they would have more, I hate the word they use, compliant, but they might have patients that are able to continue through their care journey, have less confusion. But the incentives are not really in favor of the provider in this instance. And so my concern there would be from a change management perspective at an enterprise level, because I see this having to be an enterprise tool where the patient and the provider both have to give consent in some respect. How does the provider get incentivized? Why would they want to do this? And why would it be of benefit to them?
And reduced follow-up phone calls probably aren't a big enough incentive.
Perhaps not.
And dare I say that with live active listening, you would probably get more information, which would cause more work on the physician's end, likely. I say that because, again, as humans, we hear certain things, but AI may detect other things. I've even heard organizations talk about ambient listening in rooms when physicians aren't there. So they have talked about potentially listening to patients while not there, which helps you catch essentially some of their thoughts of what they're going to do when they leave, which, again, my comment there was that's going too far, especially just because, again, you're not going to be able to change people. Knowing the amount of information that we need to know, we've got to balance technology listening with the human interaction. We cannot just start recording humans and assuming that we're going to get all of the answers or the right direction. So I think we have to walk a very fine line with listening.
And tying back into our culture conversation, it does make me wonder if it will change some authenticity, just like you said, Sarah, in those exam rooms, because there are absolutely times back when we had paper charts that I shared things with my doctor and said, don't write that down, because I wouldn't have shared it if I thought they were going to. Now I wouldn't care, but I did back then. And the same with my own personal physicians, them sharing what a hunch. It might be this, it might be that. If that's going to come up in a court record, they're not going to spitball ideas. And I think it could really negatively impact culture and authenticity. Oh, we need something. So maybe you'll come up with it, Dr. Matt.
I love that idea. I think there's definitely a problem to be solved. It's so easy for us to, kind of knock it down a bit and say, hey, what about these things? But I totally agree. This is a problem for patients, for sure. How we can solve that, I don't think we're there all the way yet. But again, things are changing so fast and evolving in the tech sector for health that in 6 months, I can't even predict that far in advance anymore. So I'm excited to see what will happen next.
Me too. Well, as we close up, any last thoughts on culture or anything else around what we've talked about that you'd want to share with our listeners?
I'm going to say stay curious. I know it's really hard right now. There's a lot of tension. There's a lot of uncertainty in a lot of different industries right now. And one of the easiest things we can do is put our hand in the sand and say I'm just not going to do anything different. I would say stay curious. This isn't a time of extreme technology revelation. Sarah's books, the sky truly is the limit. Stay curious. Don't be so black and white that says AI is bad, AI is good. Great. But also just stay curious. Robotics, whatever it is, stay curious. Instead of just showing up as a no, say not right now, but I'm going to research. That's better than a no. So stay curious, because the technology revolution is not going to slow down. And you can hate it, or you can try to come along with it at your own pace. And so I just recommend staying curious.
On my side, the old adage is you manage what you measure. And I think right now it's easy to fall back on old kinds of metrics that have been tried and true through times of business for decades. It's a new time in a digital healthcare age with the demands that we have today on the workforce, the patient, and healthcare in general. Just because it's hard to measure it or squishy to measure it doesn't mean it's not worth measuring. So I would really ask everyone to look back at the metrics they are measuring and if it's really measuring what you really want to manage.
Well, thank you both for your time and putting all your brain power into hopefully making all this better for humans at some point.
Trying, doing our thing. Thank you so much for having us.
Thanks, Amanda.
Huge thanks to Dr. Sarah Matt and Amy Gurske for the clear, usable playbook. I hope today sparked ideas for measuring and improving your company culture. I'm Amanda Brummett, and this is Generous Benefits. Practical, personal, people first. See you next time.